So good afternoon. I want to start today by giving you an update on conversations that our administration's been having with the U.S. Army Corps of Engineers, the Commonwealth's testing capacity, and our efforts to open emergency child care centers. Earlier today, we had a very productive conversation with the U.S. Army Corps about ways they could potentially support the Commonwealth and its citizens and its healthcare system during this outbreak. As most people know, the Army Corps has expertise and skills in designing and building critical infrastructure in a big hurry in times of need. Based on our conversations today with the Corps, we got a sense for the kind of work that they can do here in the Commonwealth and identified, along with several other folks, including people from the private sector, facilities that could possibly be either converted or modified to provide additional medical care capacity as we ramp up to deal with this virus. Our command center, led by Secretary Mary Lou Sudders, has been in constant communication with the hospital community to understand and assess the needs and the expectations and to scenario plan around capacity for managing COVID-19 care with our existing capacity and including alternative medical facilities. The command center is also working closely with the hospital community on the plans that they're pursuing to develop additional capacity within their four walls. Today's conversation built on this effort to better understand what type of structures may be necessary to best accommodate Massachusetts' needs and how the state can contribute to a quick response. We've already identified a number of possible sites which we want to work forward with the Army Corps and with the folks in the healthcare community to pursue further. And we've also discussed several other logistical components that we'll continue to work through with the Army Corps as needed. The Army Corps obviously has tremendous talent and a ton of experience in doing this type of thing in a number of other places around the country and around the globe. And this is obviously a mission that our National Guard could assist with as well. The Command Center will closely monitor this issue and make sure that we're doing all the things we need to do to assist our healthcare community as they and we work together to ensure that we have the capacity we need to serve our residents. I also want to take this opportunity to share a status update from the Command Center on testing. The Command Center is monitoring the Commonwealth's testing capacity and the ways in which we can increase testing for more residents. And we have made some significant progress this week. Over the past 2 days, the number of tests completed in a day in Massachusetts has nearly doubled, from 520 on Wednesday to 962 yesterday. That represents about an 85% increase in the number of completed tests. We'll post more data this afternoon to reflect the last 24 hours. Since Wednesday, testing capacity generally has also grown. Testing capacity for the state labs and commercial labs was just under 700 on Wednesday and increased to 1,144 as of Friday. This represents an increase in capacity of almost 65% for our testing capacity over a 48-hour period. And I can tell you, based on my own personal discussions with the commercial lab community, their capacity to test is going to continue to grow in significant ways over the course of the next several weeks. I want to remind folks that as the testing numbers go up and as the criteria by which you can be tested expands, we certainly expect that we'll see an increase in the number of positive test cases as well. Today, Massachusetts opened the first privately owned urgent care center in Massachusetts and started to conduct drive-through testing for COVID-19. As we speak, the Waltham AFC urgent care location has cars with pre-screened patients waiting to be tested. I want to commend the owner, Dave Adams, a former Marine and local business leader, and the City of Waltham for working together with a single purpose to stand this facility up so quickly. The new site is in addition to the CVS Shrewsbury pilot location announced on Thursday, one of 40 CVS drive-thrus in the United States, and they will play an important role in our overall effort to expand testing capacity across Massachusetts. As a reminder, for people with questions about tests, it's important to first contact your medical provider. If you think you have some symptoms, as we've said many times before, you should stay home and follow your healthcare provider's instructions. A big part of the effort to prepare for this is to keep people who don't need to be in the hospital and in the doctor's office out. This will allow our healthcare professionals to do their jobs for those that do. Last week, we announced that effective Monday, all early education centers and family child care providers in Massachusetts would close. We know that child care is an especially critical piece of emergency service and that allows our frontline workers to continue their battle against COVID-19 and to continue their work. And there are times when our families are on the front lines and don't have another option for their children. So starting Monday, we will open, as many other states have, some selected sites to serve as emergency drop-in child care services for families with no other options to continue going to work to ensure the safety, health, and welfare of the Commonwealth's residents. Child care is meant to be for those who must report to work. Outside of the obvious emergency responders and medical professionals, this will include critical service workers like grocery store employees. As of Friday, we had over 300 sites that were ready to start operation on Monday. We expect more to come online eventually, but this needs to be implemented safely, and the sites should only really be used as a last resort. All of them obviously will be operating under the policies and procedures that we put in place as part of our oversight process several weeks ago. For more information on programs offering new services for the duration of the state emergency, please visit the Early Education and Care website on mass.gov. This information will be updated on Sunday morning. In closing, I want to thank the residents of the Commonwealth for their resiliency throughout this outbreak. Lieutenant Governor and I have been fortunate over the past 5 years to get to know the spirit and determination that this particular Commonwealth has for its residents and for its family members. And that dedication has not been dimmed throughout this unsettling time. Several months ago, I was asked to speak at a Shabbat Shalom ceremony at Temple Emmanuel in Newton. A lot happened since then, but they asked me if I would be willing to come last night for my scheduled visit and speak through live stream in an empty temple. There was a lot of music because their ensemble and their cantor performed, and they were beautiful. But having a chance to speak in an empty temple on a Friday night that would normally have been packed from one end to the other with people practicing their faith reminded me in a very personal and specific way some of the things that we need to find a way to preserve despite social distancing. Now, when we issued our order to dramatically scale back public gatherings a week ago, the first community the Lieutenant Governor and I heard from was the religious community. The second one was the community that manages funerals. I can't think of 2 times in someone's life where you would want the ability to be physically close to those you care about most than during a time like this. And I can't imagine church and someone's funeral being any more special than in moments like this. As I looked out at that empty synagogue, I thought a lot about all the people who wanted to be there physically and were working real hard to be there spiritually. In the conversations the Lieutenant Governor and I have had with folks who haven't been able to attend the funeral that they wanted to attend for their loved one because of the constraints associated with our emergency orders, reminded both of us of the difficulty and the trade-offs that are associated with every one of these decisions. But many people who have had that opportunity for physical closeness taken away from them And that opportunity for the solidarity that comes with being able to pursue the gatherings on a regular basis, or even on a one-time basis that means so much to them, are finding ways to persevere and work through it. And there's no question that in this time, social distancing, personal hygiene, and all the issues we've talked about handshakes and high fives and hugs, simply can't be part of our daily routines. But time and time again, I've seen the people in Massachusetts make adjustments, deal with it, act accordingly, and step up. And I expect nothing different from this point forward.